Hi, I'm Senator Tom Harkin, and I am deeply grateful for your generosity in recognizing me with your Public Health Legislator of the Year award. I wish I could be with you in New Orleans, however, as you know, the Senate is still in session. And also greetings to your Executive Director, Dr. Georges Benjamin, and members of the APHA Executive Board, as well as members of the Iowa Public Health Association, Janine Moody, Mary Rose Corrigan, and John Lindell. And I also want to extend a very special thanks to Dr. Louise Lex from the Iowa Department of Public Health for nominating me for this award. And just for the record, if I were giving out honors, at the top of my list would be you, the members and leadership of the American Public Health Association, including my friends and colleagues at the Iowa Public Health Association. Down through the years, you have been such wonderful partners, and together we have accomplished some big, important things. I will be forever grateful for your invaluable help in passing the Affordable Care Act. For too long, America did not have a health care system. We've had a sick care system, a system that waited until people developed serious illnesses and chronic conditions, and then we spent literally trillions of dollars for pills, surgery, hospitalization, and disability. With the Affordable Care Act, we're finally changing this. At long last, we're creating a genuine health care system, emphasizing wellness and prevention and public health. We're giving Americans the tools and information they need to take charge of their own health and to stay out of the hospital in the first place. And we're recognizing that good health isn't only achieved in the doctor's office. I especially want to thank you for your very strong support of the Prevention and Public Health Fund in the Affordable Care Act. This is a truly transformational initiative, and we must protect it from further attacks and budget cuts. In my state of Iowa, the Prevention Fund has already supported grantees doing everything from implementing chronic disease self-management, educating kids about healthy eating and food preparation, and distributing fruits and vegetables to low-income and elderly families. And states across America have similar stories to tell. APHA has also been a long-standing partner as we've worked to ensure that our schools are places that promote health and learning rather than just another market for the big food companies. We've worked together to expand the fresh fruit and vegetable program, to modernize and improve the school lunch so that it emphasizes whole grains and vegetables rather than French fries and salt. And with your help, this year for the first time, we'll have sensible rules for snack foods and beverages sold in school stores and snack bars and vending machines. For too long, this junk food loophole has allowed healthy meals provided through the school lunch program to be undermined by junk food elsewhere in the school. And I'm especially grateful to you for working with me to close this loophole for good. And I especially want to thank our great Secretary of Agriculture, Tom Vilsack, for standing strong on this critically important issue. Finally, in schools and workplaces and communities, the healthy thing to do is also becoming the easy thing to do. Companies across the country are investing in workplace wellness programs to help employees stay healthy, which is good for employees and good for business alike. And it's about time. For too long, America's healthcare system suffered from a serious pre-existing condition. It's called complacency, an indifference in the face of diseases and suffering that are entirely preventable, if only we make the upfront effort. So you folks are changing this. You're making a difference in your daily work back home and in your communities. You're working to transform America into a genuine wellness society. And that's about the most important work that I can imagine. So at the end of this year, I'm retiring, as I said, from the Senate, but I'm not retiring from this fight. I will never retire from the fight to improve prevention and wellness in our country. After retiring from the Senate, I will be working closely with the Harkin Institute for Public Policy and Civic Engagement at Drake University in Des Moines. You can always contact me through that institute, and I can assure you that one of our agenda items will be improving and extending our concepts of public health, both here and abroad. So my friends, I have been so proud to be your partner through all these years. I deeply appreciate this award and your support and your generosity. So thank you, and by all means, have a safe trip home afterward.